are two big stretches that a lot of our clients that have hip or glute tension, they overstretch this and it causes them even more back pain and hip instability. It also is known for pinching the nerve in the back. We have seen it time and time and time again, and when we tell people to stop stretching it and when they finally listen to us, their pain gets a lot better. So try it out, let me know, avoid it for the next 2 weeks, and if you really feel strongly about the fact that you want to do this, reach out to us or just trickle it in a little bit, and don't do it too often, and see how your body feels. Sometimes it can feel nice for the next little bit, but 3, 4, 12 hours down the road, the nerve is overstimulated and frustrated. So making sure that we just pause on it for a little bit to get very clear information on what it is that we can do to support us so that we can get faster relief in our body. So here it is. One of them is working on our glutes. So a lot of my friends, my clients, and including myself in my past life, like to sit on a lacrosse ball or a Yamuna ball and really work the glute area where we're sitting on it, we're just going ham on that glute, right? So this is one example of something that I do not suggest until you've created a lot of space on the front end. When you have created a bunch of space on the front end and we know that we're doing okay, I would suggest only getting into the piriformis area, which is right on the back side of like where we worked on the hip flexor, right here, not pinching on the psoas and on the sciatic nerve. Knee comes together, drop it down, and just do a few of these. Only a few seconds getting into this tissue, activating it, and then you're done. That's all you'll do even when you're in a really healthy, happy place, and it'll open everything up. The next one that people overdo too much is they do the figure 4 pose, and this opens up your hip, it opens up the glute, but a lot of times it will actually cause a lot of tension and dysfunction in the body as well. So at the very beginning, and only give us 2 weeks of trying everything else. After 2 weeks, then we can assess and see, hey, I still have tension, I've been really consistent about doing everything the way you've told me to, but I still really feel like I need to get into my glute. Then maybe just try it for just a few seconds, get in there, get out of there, and then take note, use your pain journal, get to recognize, hey, how does my body feel 12 hours after I do this? Or is it more sore than when I wasn't doing it? Because it's a great way. Every single person moves differently. We need different things. Some people do need to get into their glutes and activate their glutes, but most of us just need to open up our anterior side, the inside of our adductors, our psoas, our pelvic floor will help us actually create the space that we're looking for in the glute. So let's chase the root pain, not what is hurting, even when our body is just dying to have something sharp in our glute. You've got it, friends. I'll see you soon. Bye.